Is it a common combination to have inverted nipples sometimes and a little bit of gynecomastia? Not really, no. I mean, inverted nipples is less of a common issue with men, and obviously gynecomastia is, by definition, with men. It's excess breast tissue in a male. So inverted nipples is more common in females because it's due to scarring and tethering of the milk ducts. So the short answer is no, it is not a common combination to have inverted nipples and a little bit of gynecomastia. It would also be difficult to, because I'm thinking of I don't think I've ever done a gynecomastia where I've corrected an inverted nipple, because I would be a bit anxious about correcting the inverted nipple at the time of the gynecomastia, simply because the blood supply of the nipple, you're already going completely underneath the nipple when you do a gynecomastia. So if it was short ducts, that should solve the problem, to be honest with you. But I wouldn't normally go directly into the nipple to do things because I worry about blood supply. So it's not a common problem. It may well be because we're taking all the tissue underneath the nipple away that it would revert itself. But I wouldn't be going into heavy to correct the inverted nipple specifically at the time of a gynecomastia, because I wouldn't want the blood supply of the nipple to be altered. Because when you do a gynecomastia, you make, or when I do it, I make a U-shaped incision on the areola, the base of the areola, and I wouldn't then want to go too much into the nipple to try and do things to potentially mess the blood supply up. So I would probably say to you, look, I will try and do my best to improve the inverted nipples, but my main focus would be the gynecomastia correction, assuming that's your main problem. I guess the flip side is if the inverted nipple is your main problem, you could have just a local anesthetic procedure to have the inverted nipple fixed, and then consider whether you wanted the gynecomastia later. So maybe doing them as a staged procedure. But if I had a choice of which way I would do the staging, I would do the gynecomastia first, because I say that may well improve the inverted nipple correction, although it couldn't be guaranteed. Whereas if you do the inverted nipple correction first, there's no way that's going to make the gynecomastia better. So that's kind of my rationale thinking.